Well, hello all, and welcome to our virtual event, Nonprofit Collaboration in Challenging Times, coming together to serve the communities we love. My name is Catherine, and I'm on the Connecticut Food Bank / Foodshare team. And I'm thrilled to be here today with two local leaders who individually and in collaboration with their boards of directors and staffs are working to improve the lives of our fellow residents in Connecticut. So without further ado, gentlemen, could you please introduce yourselves and share a little bit about your organization?
So my name is Steven Zuckerman. I'm the president and CEO of the Root Center for Advanced Recovery. I've been their CEO for a little over 4 years now. We treat individuals with substance use disorders and mental health diagnoses. We have 10 sites throughout Connecticut, and we serve approximately 6,000 patients a day.
And I'm Jason Jakubowski. I'm the president and CEO of Connecticut Food Bank / Foodshare. I've been the CEO of Foodshare for the last 4 years, but back in the beginning of February, the two food banks merged together in a historic merger, and we are now one large food bank serving the entire state of Connecticut. We've been around for about 40 years, and we serve about 545,000 people who are food insecure right now here in the state of Connecticut.
That's great. So we are all coming up on about a year living in a COVID reality, and I'm curious if you could share a little bit about how COVID has impacted the communities that you serve.
Go ahead, Steven. You want to go first?
Sure. Well, obviously a year like no other. So to put it in perspective for us, DPH, Department of Public Health, just released their statistics for 2020. 2020 saw a 13% increase in overdose deaths throughout the state of Connecticut, off of previous record years. So correlation certainly doesn't mean cause, but 13%, we feel pretty strongly that the pandemic had a profound impact. Obviously, the support systems, the social networks, which keep our clients safe and continuing their recovery, shut down as well. So again, 13% of husbands, wives, cousins, mothers, brothers, sisters died this past year. And again, an increase over previous record-breaking years. So a profound impact on our care.
Yeah, and the same thing here at Foodshare and Connecticut Food Bank. There's been a 32% increase in food insecurity here in Connecticut since the beginning of the pandemic, and it's incredible. There's definitely this misnomer out there that we live in Connecticut, the richest state in the union, and that there's no problem with anything like food insecurity. Everybody's got plenty of money to be able to afford food, and that's not the case. And we really saw that this year with the pandemic. We've been doing emergency food distributions for about a year now. We started them at Rentschler Field about a year ago. The first time we did a survey out there at Rentschler Field last May, we discovered that 74% of the cars that were driving through that distribution had never used one of our services before. I'm rarely at a loss for words. I was at a loss for words over that, because what it meant was that was the number of new people who had never had to experience food insecurity, who just for whatever reason, they had a 5 or 6 figure a year job, and due to no fault of their own, the rug was pulled out from under them, and have found themselves in this precarious situation.
Yeah, just to jump on that a little bit, I had the fortunate opportunity, or maybe unfortunate opportunity, to be with Jason one day at Rentschler Field. And at that point, it was a record day for Foodshare as far as the cars came through, and they have since broken that record 10 times over. And it was astounding to me the amount of cars that were just nonstop coming through Rentschler Field, and had a profound impact on me. It's one thing writing checks and such. It's another thing. What I like to say is called bearing witness to what's happening.
Yeah, and when we were first out, I remember Steven and you and a couple of your board members were out there with us at Rentschler, and really the first time people see it, it is kind of like an amazing, wow, this is Connecticut. This is the year 2020. This is the year 2021. This is incredible. But it kind of relates to what we're here talking about today with nonprofits helping nonprofits. And Steven, I give you and your board all the credit in the world for recognizing this in the early days of COVID, that many of your clients are our clients. These are not different people, and the idea of treating them and putting them in silos as society has, and quite frankly, the nonprofit sector has for so many years, is this is a great step towards recognizing that we are all in this together.
Absolutely. One of the things we talked about at the board level was, if anything we've learned is breaking down these silos are key. We're a nonprofit for sure, but if another nonprofit fails, there is a profound impact on our own clients as well. There's that trickle-down impact. So we have 6,000 clients a day. Many of them access Foodshare services. So if Foodshare failed, if Foodshare didn't exist, one of the precursors to relapse are psychosocial stressors. So if they didn't have Foodshare to be able to deal with the food insecurity, we talk about a 13% increase in overdose deaths year over year. I'm sure that number would have gotten a lot higher if not for the work of Foodshare, because they were at least able to tackle one of the major stresses for them, which was food insecurity.
And that goes both ways as well. I mean, if the route and services like the route didn't exist, what would be the impact on a service like Foodshare and Connecticut Food Bank? Our interest is not in giving people a permanent way of life. Our interest is in helping people out in the short term till they can get back on their feet and they can earn, and they can earn to the point where they can afford food on their own. If one of the impediments to that tends to be, obviously mental health and addiction issues, if you went away, we now have our problem just got compounded about tenfold. So it's a dynamic that I think I'm glad that we've recognized.
Yeah, and I think the mindset oftentimes is of a competitive nature. And I think this has caused us to certainly introspect more now than ever that we all need each other so much. So we've been very thankful for these for this time to help us challenge our way of thinking about nonprofits and peer groups.
Yeah, absolutely. The competition piece, I think there is definitely this inherent feeling certainly in for-profit sectors, but also in nonprofit sectors, even organizations that do the same thing, that may do the same thing in different areas, view themselves as competitors. And I'm completely with you. I mean, I think we've got to start breaking down those silos and seeing that. So,
yes.
Well, great segue, gentlemen. So how can different social service sectors come together to serve our communities during times of stress?
Well, there's a number of different ways that we've tried to do that, and the example that I'll use is our mobile sites. We have about 100 different mobile sites across the state of Connecticut now. And these are non-emergency distributions. These are regular distributions where you go into an area. Sometimes it's an urban area. Sometimes it's a suburban area. Sometimes it's a rural area where there's just no access to a grocery store. And there's people lined up and waiting for the food truck to come and us to be able to provide food. While they're there in line, we've realized several years ago, that's a captive audience. What other information can we be giving them? What other services can we do? We have had Access Health CT out there helping them sign up for health insurance. We have had organizations, healthcare organizations like Hartford Hospital and others out there giving people information about screenings. We have given out information on things like mental health and addiction services, on things like job readiness programs, and even something simple like registering to vote. Around election time, we have the Secretary of the State come out, and she's come to a number of our mobile sites just as people are standing in line saying, "Hey, do you want to register to vote while you're here?" So, meeting people where they're at, I think is the key.
Yeah, and continuing to look for partnerships. We knew during COVID we needed help with testing of our staff, testing of our patients. We partnered with Intercommunity. Great partnership we established with Intercommunity, where Intercommunity came to a number of our locations and did COVID testing in our parking lots for our patients and staff. That's their expertise. That was huge for us. The Urban League of Greater Hartford, we felt that we needed to do a whole lot better when it came to diversity, equity, and inclusion. We partnered with the Urban League to figure out how can we do better. during these difficult times. It was such a successful partnership that their CEO is now one of our board members. But also, I think, like Jason said before, I think really inherently looking inward, I think we have a responsibility, nonprofit or for profit, if monetarily an organization is having some success, looking about how you can give back on during these times, because there's again so much dependence upon each other. But some organizations don't have that monetary flexibility. One of the things we talked about at an organizational level that I'm very proud of, and that we're going to implement in our new fiscal year starting July 1, is that every single staff person in our organization come our new fiscal year is going to have a day off from the organization paid by us to volunteer their time at an organization within the community we work. So we have 10 sites. So we're in 10 different communities from New London to Torrington. So we're going to have staff volunteering in all of those communities one day. That takes no money. That takes no endowment. That just takes releasing your staff to let them pay it forward and let them to bear witness in these other environments. I had the good fortune of a couple of months ago, and Jason let me do this. I volunteered at Foodshare.
We didn't let you ride the forklift or anything,
No,
Steve.
no.
We didn't, no heavy machinery or anything like that.
There was no heavy
careful.
machinery, and I definitely kept a lookout to make sure nothing fell on my head. But I must have bagged 75 bags of food that day. Yep. And it's one thing writing a check, easy to do. Another thing, actually bearing witness and being in that environment and seeing that. And also I had the good fortune of taking my 19-year-old daughter with me to be able to sort of see that in action as well. And I know it had an impact on her, and realizing that we are privileged in many ways and we're fortunate. So let's make sure we're giving back.
Yeah. And Steven, I can tell you, definitely with regard to the idea of giving staff time off, we implemented a similar program about 3 years ago. It pays off in dividends, not financially. It's not going to it's not going to impact your bottom line positively or negatively. But I've seen how employees, first of all, appreciate being given the opportunity to go out into the community. But secondly, our community partners, the other nonprofits, all the pantries we deal with are all nonprofits. The organizations we service are nonprofits. They're appreciative. So I'm telling you, you will not regret that. You definitely will not.
I do these quarterly town halls with our staff, and unfortunately of late they've been Zoom.
Everything's Zoom now.
Yeah, and we announced this to all of the sites over the course of the past few weeks. And I do a plus delta at the end of every meeting. What went well from the meeting? What could have been better? And everyone's plus to a person has been the fact that we're going to be doing this in the coming fiscal year. So lots of excitement.
No, it's a great thing. You did talk. No, you talked about writing checks, and I do think we're not gonna hide the fact that we are nonprofits, and that is absolutely a part of our business model. And this relationship between Connecticut Food Bank, Foodshare, and the Roots started with a check, and I think that's an important thing to remember, because there are some organizations that have the means by which to contribute to other organizations. And as we always look through philanthropy, and Catherine, I know, you're a philanthropy officer, you've been doing this for a long period of time. What do we think of? We think of, okay, let's look at the big corporations. Let's look at private foundations. Let's look at individuals. We hardly ever, if ever, look at other nonprofits, because the old paradigm is, nope, that's our money. We do that with our money. We're not giving it to another nonprofit. I think what you guys started here, Steven, is a great is a great thing that actually we've stolen a little bit here at Connecticut Food Bank and Foodshare. Earlier this year, right after our merger, we distributed about $500,000 worth of COVID relief funds to our nonprofit partners that we deal with out in the community. These are pantries that are delivering the food that we procure. And most of them, the reaction is the same as when you first came to me and said, we want to make a donation to you. I was like, they were like, this doesn't happen. What are you talking about? I mean, you don't do this. And I was like, yeah, no, we are, but we are doing this because we're all in it together.
Yeah. I kidded around with Jason when this first transpired, when the first donation was whenever it was, last summer possibly.
Mhm.
And when I go to my board, we've been fortunate enough to have this endowment that's been built up over 50 years or so. And if I go to my board and I want $1 from that endowment for operations to buy a pencil, they say no every single time. If I go to my board and I say, hey, can we take some of that money and give it away to nonprofits? They say yes every time.
Yeah.
So that's sort of the mindset of our great board of directors.
Yeah, that's great. And to know that people are willing to think creatively and to be utilized in new and nuanced ways if the circumstance calls for it. That's really impressive. Similarly, we know that leadership comes in many different forms, but from your respective perspectives, what contributes to effective leadership in a crisis?
You want to go first, Steven?
Sure. I think for me, lead by example is something that has been important to me throughout my career. So I think being out there in front, effective communication, lots of communication. We had to go to a staggered schedule, and many folks were able to work from home, but we had many staff that couldn't work from home. Our nurses, our dosing nurses couldn't work from home. And I never worked from home. My belief was, if not all of our staff have an opportunity to work from home, I'm not working from home either. So that's very important to me. I do a clinical therapy group on a weekly basis with patients. I doubt that there's many CEOs in behavioral health right now, peers who are also treating patients. I think it's important for me to sort of see what our clinical staff manage and deal with on a regular basis. Yeah. But again, leading by example, communication, and one other thing I've learned, making sure that you have a solid emergency management plan. I think that is key. Reviewing it on a regular basis and making sure your technology is up to par. If our technology wasn't where it was, we could have had many more tragedies because without our availability, which we had to move towards telehealth and virtual, it could have been catastrophic for many of our clients if we were not as prepared as we were from a technology standpoint when you were trying to reduce foot traffic within our clinics.
And I would agree with all of those points, Stephen. I mean, communication is key. And I made the decision early on that even if it annoyed my staff and even if it annoyed volunteers and donors, I was going to over communicate if I had to. But constant communication is key. Keeping people in the loop is key. Presence is absolutely a big piece of it. I mean, you and I both work in industries that cannot be done completely remote. And, the tough thing for us at the beginning of the COVID pandemic was there were definitely some jobs at the food bank that could be done remotely, and there were some that absolutely could not. I made the decision early on, as did my chief operating officer and others. We were going in every single day. I mean, that's, everybody, folks were there in the building. We were going to be there in the building as well. It was not the time to take off for a family vacation to Cancun or any other or any other place. So physical presence is necessary. The other two things I would add to the list, one is being nimble and being able to adapt quickly. The thing we discovered at the beginning of COVID was, and maybe this is just unique to this crisis because not all crises are the same, but this was one in which it was almost impossible to plan. Literally, things were changing by the day. One day we were being told masks don't do anything. The next day we were, everybody should be wearing masks. So literally overnight we had to figure out, okay, how do we get thousands of masks to give to all of our partner agencies? So ever evolving and being able to be nimble. And the other piece is, we talked about our boards before. Leadership does come from the top. They were always, they do not, they are not involved in the day-to-day operations of the organization, but we kept them aware of what was going on at all times. They appreciated it, and they were very supportive in giving us the flexibility that we needed in order to move this forward. So that relationship with the board of directors was essential. If they wanted to sit there and micromanage every change that we made, on the fly, that would have been a very different result about a year ago.
Yeah, absolutely. You mean you didn't have the CEO 101 pandemic playbook? I had it.
No.
You didn't have it?
Yeah, I had it. It was blank. There was nothing. I was flipping through it, and there was nothing on any of the pages. And there's so many things too. There's personnel decisions, and you've got to continue your service. Oh, and by the way, you've also got to make sure that there's still income. There's still revenue. You have state contracts, I assume, Steven. So
we have.
That must have been, that's like changing overnight, I imagine.
Yeah. Luckily enough, we don't have a lot, which I think helped us. But yeah, certainly something we have to manage. And I think the other key thing is I've been very fortunate, as I'm sure Jason has, is I have an excellent team as far as my leadership team, from my executive leadership team to our directors, who really allowed me to do some of the fun stuff, which is going over to Rensselaer Field and giving Jason a check. Going to the offices in Bloomfield. Without that team, I would have been knee deep in day-to-day operations. So they, the luxury they provided me is to be able to engage in some of these things.
Absolutely, I agree with that 110%. The fact that I had not just competent, but excellent leaders working for me meant that I didn't have to sit there and watch every single thing going on, and had the time to do those things that are fun, but also very important. The other thing we learned with our donors, with volunteers, and I've taught political science for years, so there's always this theory when it comes to government in times of crises. But it's true for a nonprofit or any organization. Your constituents need to know there's somebody in charge. And literally, you can't just hide out in your office. You've got to be present, not only in the office, but you got to be present for your entire community. And I think that's what we've tried to do during this difficult time.
And you've done it amazingly well.
Oh, thank you. As have you. It's been an amazing year, and hopefully we never have to do it again.
Yeah, I can't think of what the state of Connecticut would have been like without Foodshare. To be
thank
quite
you.
honest, and our board, to a person, all thought the same exact way.
Well, thank you. We appreciate that very much.
Yeah. So you both alluded a little bit to sort of what are the things that we can and maybe should be doing to prepare in advance for the unknown. But are there any other pearls of wisdom that you have in that respect? How we really prepare for what will undoubtedly be stressful and challenging, potentially not as much so as the last year has been, but there will be challenges that will arise.
We talked a little bit about it before, but this was certainly a wake-up call, like no other. I've had great mentors in my career who've gotten me to the place where I am today, but calling on them, well, we never experienced this. So I think that wake-up call certainly tells us, again, as we talked about before, having emergency management plans, constantly drilling on those emergency management plans for things that you never thought would happen. They're going to happen. Constantly reviewing your technology. I think those are key things. We were good at that before, but certainly not as good as we should have been or could have been. So I want to make sure going forward that we're in a better place, and hopefully our peers are certainly are assessing this as well. Nonprofits, unfortunately, typically don't have the financial infrastructure to be able to do some of the things that our organization was able to do based upon our support system and our endowment, to nimbly be able to move and get new IT equipment, to be able to access PPE a little bit more quickly. So again, I think preparation here on in for many of these nonprofits, especially some of these smaller nonprofits, is going to be extremely, extremely important.
Yeah, having the plan and having the technology are key. I remember my first job out of grad school, this was maybe 20 years ago, we did an exercise in which a group from FEMA came in and said, okay, we're going to plan in case there's a pandemic. And I remember now, I was an arrogant 20-something year old kid. My first one was like, this is stupid. No, this is never going to happen. I mean, come on, we're preparing for the worst here. It's never going to happen. Well, it happened, and it helps that there is that preparation. The technology piece is key. it is very tempting, and I've served on a lot of nonprofit boards, and I worked for a lot of nonprofits. It is very tempting, especially in the nonprofit sector, to say, let's put those technological advances off for another couple of years because we don't absolutely have to do them. If at the beginning of this pandemic, we didn't have the ability to instantly if my staff couldn't just take their laptops, go home, and know that they can get all of their files and everything else, I don't know what we would have done. If on day one, my director of IT had to sit there and say, let me think about how we can configure the network so that people can use we already would have been behind the 8 ball. So investing in technology is essential. It really is.
It's really helped us, I think, also as an advocate for me when it comes to a nonprofit board. We've done a good job here making sure we have an eclectic board that have lots of different specialties. So, we have a board member who's an IT guru, really, in the state of Connecticut. So he's really helped me over.
Because you and I are not, Steven. Let's be honest. Let's be honest.
I am not at all. Brittany is my lifeline.
Yes,
I am not at all. So he has really helped me over the past 4 years to be able to advocate. We had no website when I got here. We had no electronic medical record when I got here. We had no technology whatsoever to be able to do anything. So very important to also have those advocates behind the CEO to be able to help support those changes and stress why it's so important.
Right. Absolutely.
That's great. So we are all slowly eking back towards normal times. What charge do you both have to others as we move beyond the really heightened sense and the stress that COVID has sort of weighed on all of us for the last year or so, and as we move into normalcy?
I'd say first of all, don't forget where we've been over the past year. And that doesn't mean that you need a daily somber reminder of the 500,000 plus lives that have been lost in this country. When I say don't forget, I mean, just remember that this can and has happened. And that's an important mindset. The other thing is what I would say to everybody, be flexible in what you're thinking about what normal is. And it's not, normal is not going to be what it was 100% before the pandemic. For our businesses, for our business models, for the way that we interact with one another, from major things like that to simple things like we don't know how much longer people will be wearing masks, or are people going to feel comfortable going to Yankee Stadium and watching a ball game? I would encourage my staff and encourage everybody to just keep their expectations in check especially over this next year, because normal is not going to be back to what it was immediately. And it's certainly for the people we serve, it's not going to jump right back. This thing we didn't flip a switch and turn everything off, or we may have flipped a switch and turned everything off. We're not going to just flip a switch and turn everything on. We are responding here at Connecticut Food Bank and Foodshare to the economic impact of the crisis of the virus, not the virus itself. Yes. And there's always a lingering effect on that. There always is. So,
yeah, I concur. There's not a whole lot to add after what Jason just said. I concur with everything he said. I think the only thing is, we talked a little bit about this earlier, is making sure we're getting out of our silos. The nonprofit system in particular are such fragile systems. And survival can change on the drop of a dime. And really, as we talked about before, we're more dependent upon each other than we think. Like I mentioned, my 6,000 clients a day, the amount of food insecurity of those 6,000 clients is significant. We serve 95% Medicaid and Medicare. Okay, so food insecurity is huge for them. Again, if that psychosocial stressor is not met, and we talked about a 13% increase year over year, if Foodshare wasn't there, and many of the other nonprofit organizations weren't there, it has an impact on your own organization. If you want to be siloed, you're not doing your organization, your staff, your patients, if in your healthcare, any service.
I agree, and I do hope that nothing good. There is no good that came out of this pandemic. If there was any silver lining, it was that people have learned how to work together and people have taken down those silos. I really, really hope that we don't spring back to where we were before, and we remember this new paradigm that we're creating.
And I think you and I, for sure, at least the two of us, have vowed never to go back to.
We're not going back. We've got it.
Doing business.
Absolutely, 100%.
And what's great is I feel like I have, for me also, relatively new CEO, 4 years. It's great for me also to have someone like Jason, who's not a board member, who is a CEO, who has to deal with nonprofit boards as well, even when they're fantastic. But to be able to have someone to be able to call and just sort of process, debrief, bounce things off of. So that's been a great part of the relationship as well, even if it's just passing.
Same here. There is definitely there's definitely a camaraderie among nonprofit CEOs that we understand each other. we get it. So I agree.
Great. So how can folks who are maybe watching this today engage with your organizations moving forward?
Well, for us, I think the best way to probably do that is check out our website, rootcenter.org. And we just changed that website probably about, 6 months to a year ago. It really has every single way to be able to contact us and reach out to us possible. We have a great deal of social media. We're on Facebook, LinkedIn, YouTube, Twitter, Instagram. So lots of ways to be able to connect with us. And if we don't have what you need, it's important that my team knows how to help you get to where you need.
Yeah, and for us, all of the above. You can go to ctfoodbank.org. You could go to foodshare.org. As we continue to merge, we're obviously merging our social media and we're merging our websites, and we will have a combined name over the next couple of months and everything. But right now, ctfoodbank.org or foodshare.org, and we have all of the same social media platforms. We try to do the best we can to relate to individuals, to our donors, to our clients, and to the community at large. So we're out there, and I guarantee you send us a message on Facebook, or you ask us a question on Facebook, we'll respond. And it'll be a real person, not a robot.
Yes. Same thing. Brittany's like lightning.
Yeah.
So if there's something that goes on there, she's there to respond. Absolutely. Yeah.
That's great. Any concluding remarks, thoughts? We're just so grateful for both of your time and discussion today. And if there's anything else that you wanted to add, now is the time to do so.
I'll say thanks again, Steven, because this really was started by you and your board doing an extraordinary thing about a year ago and making a financial investment in another nonprofit. And I think it has set the stage for a new paradigm here in the Connecticut nonprofit community. So I appreciate, I enjoy spending time with you. I enjoy talking with you, but ultimately, we're very thankful for that.
Yeah,
thank you.
I appreciate that. Thanks. And I concur. It's been, we have very difficult jobs at times. As my board president likes to say, Bruce Simons, a great guy, and he'll say, "You're never going to regret giving a check to somebody like Foodshare."
We appreciate that,
and he's right. It's one of our best days to be able to collaborate and give back in such a way. So I just hope we're fortunate enough to continue to be able to do those things, but more so to continue to be able to partner with such great organizations as yourself.
Absolutely.
Thank you.
Great. Well, thank you both. And thanks for everyone who joined today.